All right. Good evening, everyone, and welcome to episode 11 of this Facebook Live series, where tonight Dr. Steele and Newton will be discussing the topic microaggressions and mental health. So I will get us started by introducing myself. My name is Tatyana Smith, and I'm going to be the moderator for our conversation this evening. I'm a fifth-year counseling psychology doctoral student at WMU, an APA Interdisciplinary Minority Fellow, a King Chavez Parks Fellow, and a therapist in the Counseling Center at WMU's Syndicuse Health Center. Dr. Sharmika Newton is the co-author of the newly released book, Black Lives Are Beautiful, 50 Tools to Heal from Trauma and Promote Positive Racial Identity Development, published through Routledge. She is also a fully licensed psychologist and owner of Legacy Mental Health Services, PLC. Dr. Char has over 10 years of experience in clinical, academic, and community settings, including teaching experience at both undergraduate and graduate levels of higher education. Her areas of expertise include multicultural counseling and clinical supervision of master's level counseling practitioners and students. In addition to her clinical and teaching expertise, Dr. Newton is also a member of the Michigan Board of Psychology, appointed by Governor Gretchen Whitmer, and in 2022 was honored with the Distinguished Psychologist Award by the Michigan Psychological Association. Recently, she was also appointed to the American Psychological Association's Advocacy Coordinating Committee and elected to serve on the Executive Committee of the Society for the Psychological Study of Culture, Ethnicity, and Race, a division of the American Psychological Association. Her video, The Hate They Give, The Love We Have, was also recently selected for inclusion in the APA's Cultural Informed Trauma Recovery Toolkit. Dr. Janeé Steele is the other author of Black Lives Are Beautiful and a licensed professional counselor, counselor educator, and diplomat at the Academy of Cognitive and Behavioral Therapies. Dr. Steele is also the owner and clinical director of Kalamazoo Cognitive and Behavioral Therapy, PLC, where she provides therapy, supervision, and training in CBT. She additionally holds several committee appointments, serving as a board member on the Academy of Cognitive and Behavioral Therapies, a board member of the National Social Anxiety Center, a member of the Diversity Action Committee of the Academy of Cognitive and Behavioral Therapies, and a member of the Association for Counselor Education and Supervision's Professional Development Subcommittee. Her scholarly activity includes peer-reviewed articles focused on CBT, social justice advocacy, and counselor training. Her favorite article describes cognitive conceptualization and treatment planning using CBT and a proposed cognitive model of internalized racism. Her webinar discussing the proposed cognitive model of internalized racism is one of the American Counseling Association's best-selling products and was featured by the organization as part of its 2022 BIPOC Awareness Month programming. So tonight's discussion focuses on microaggressions, which are a form of racial or diversity-based discrimination. We recognize that issues related to racial and other forms of discrimination can be deeply painful, and discussion of issues can at times be overwhelming. With that in mind, we always like to begin with a reminder about the importance of self-care and mindfulness during our time together. If you find anything to be overwhelming, please be sure to use mindfulness and breathing skills when you need to, and to take a break if necessary. We also ask that you work toward maintaining a non-judgmental stance, recognize any defensiveness you may be experiencing, and listen during tonight's discussion with the intention of understanding. With that said, keep in mind that our conversation tonight is not a substitute for mental health or medical advice, and you should seek appropriate help where needed. Now we're going to get started. So my first question that I have for you both is, what are microaggressions, or how would you define microaggressions?
I think for me, the thing that stands out definitionally as it relates to microaggressions is the fact that they are subtle, often unintentional messages that reflect discriminatory attitudes. So those messages can be verbal, but they can also be expressed through the environment as well.
And when I think about microaggressions, I think the thing that stands out is it's not just about race, but there can also be microaggressions that occur based off of someone's gender or sexual orientation or even religious affiliation. There are those like everyday slights that individuals experience. I think an example would be like saying to an African American, well, you speak so well, you're so articulate. While the intent is to provide a compliment, maybe the stereotype or the aggression is that, well, Black people don't speak well, like you weren't expecting the person to be articulate. And so even if we think about LGBTQ plus populations, like using someone's wrong pronouns or can be a sign of or a symptom of microaggression as well. So I think it occurs across different areas of people's identities.
And so then to go along with what Dr. Newton was saying, Daryl Winsue and his colleagues has done a lot of work on this topic, and they identify 3 specific types of microaggressions that further helps us to understand like what they might look like in an everyday situation. And so the first is called a micro-invalidation, and that's a message that unintentionally conveys some discriminatory attitude regarding someone's heritage or some aspect of their social identity. And so again, we're highlighting the unintentional, perhaps even well-meaning nature of this statement. And an example, again, illustrating the idea that a microaggression can occur across social identities might be using a louder tone of voice to speak to someone with blindness or low vision, right? So the assumption is that their disability affects all aspects of their personhood rather than that one specific ability. And then the next one would be a micro assault, and that is a microaggression that more overtly conveys a discriminatory message. And so that might be illustrated in the language we use. For example, at one point in time, people often said something was so gay to describe something that was awkward. And so now we recognize that as a microaggression because it's explicitly demeaning to a person's lived experiential reality. And then there might be a micro assault, which really is just use of something that's very, very overtly discriminatory or prejudiced. For example, using a racial slur or displaying some type of racial symbolism.
Yeah, and I think the thing is that they occur within so many different domains of our life, whether it be through, social media, on TV programs, mascots of different schools or universities. People experience them in their everyday work environment, but then, even media may portray microaggressions. So people who are a part of these various identities experience it on multiple levels.
Mm-hmm. And so we often talk about things like gendered racial microaggressions, right? So that might be a microaggression that's, for example, specific to the experience of being a Black woman. I know something that bothered me for the longest time, especially like in the early 2000s, is people would come up to me and say, oh, natural hair looks so nice on you, right? Like, so the message behind that is one that natural hair isn't nice, natural Afro hair isn't nice, but you're the exception, right? It looks okay on you.
Mm-hmm.
Mm-hmm. And I think to the piece about the gendered racism piece, even hearing statements like, oh, you're cute for a dark-skinned girl, and the messages that conveys and how that intersects with experiences of colorism and texturism, even when we talk about comments made about Black women's natural hair. I think it's also helpful to add that in the context specifically of racial microaggressions, oftentimes these represent covert forms of racism or what's known as modern racism, or like you were saying, Dr. Steele, symbolic racism or aversive racism. And oftentimes they're accompanied by implicit bias, which you both do a lot of work in educational workshops around. And to the piece that you were talking about, Daryl Winsue and colleagues that he's worked with, they've talked about, the power of microaggressions, and in particular, racial microaggressions lies in their almost invisibility to the perpetrator and oftentimes the recipient, because what oftentimes ends up happening is there's this questioning or self-doubt for folks who occupy, various marginalized identities. Like, is what I experienced really what I just experienced, or am I tripping? Like, but they didn't explicit, like, it's not always explicit.
Mm-hmm. Yeah, and so I would say, like, rather than an invisibility to the target of the microaggressions, it might also be described as like a sense of uncertainty. And we all know, right, like when we experience prolonged uncertainty, that can become psychologically distressing. And so just that aspect, beyond like the discriminatory messaging that is reflected in the microaggression, the sense of uncertainty and the constant need to emotionally regulate yourself in response to these statements can become psychologically distressing over time.
Yeah, and I think that what you just shared, Dr. Steele, gets into the next question of talking about more specifically how do microaggressions impact people's mental health and well-being.
I think kind of, Tatyana, you were hitting on this. It may lead to something called imposter syndrome, where if you're always being questioned or your presence isn't being, understood, or it's being labeled or stereotyped, it may cause the individual to really believe, like, do I deserve to be here? Do I have what it takes to make it? So I think imposter syndrome may occur with individuals when you experience microaggressions. The analogy I like to use with it is kind of like a mosquito bite. You get bit once, it's like irritating if we've ever had mosquito bites. If you keep getting bit by the mosquito, you keep getting hit with microaggressions, it's going to cause you to question your mere existence and your validity. And so things like imposter syndrome, and then I think the other piece, as it relates to our psychological well-being, is just internalized racism, which we were talking about earlier. The ideal of, am I good enough? And you begin to believe the messages of white supremacy about yourself. And so those are two things that stick out for me as it relates to microaggression and psychological well-being.
Yeah, and then like beyond the racially salient symptomatology that you're talking about, Dr. Newton, research also shows that um, repeated experiences with microaggressions lead to the development of some of the typical psychological disorders that we see in our everyday clinical practice, right? So it could lead to things like depression or anxiety or even suicidal thoughts, which for me underscores the significance of broaching topics related to race, ethnicity, or culture in our work with our clients, because while we might, based on the client's symptomology, understand that they're dealing with anxiety or depression, without directly broaching like how their lived experiences as members of their various social identities are influencing like the nature of that, how that disorder is expressed, then we won't fully be able to conceptualize and provide like the most valuable and culturally authentic and relevant treatment for that individual.
Another thing, kind of as you were talking, that stood out and that came to mind was just we may see it manifest itself as a lack of self-love, where individuals, they begin to hate or not appreciate their, for example, if you're Black, your Blackness, or their racial identity, or that part of themselves that gets microaggression, they may begin to separate from it and try to merge more into the dominant culture. And so when we look at things like Cross's racial identity development model, it may push people to not get further along in the model as it relates to appreciation of self and appreciation of self-love, which I think is important for being a well-rounded person.
Yeah, and I think to add to what you were just talking about, Dr. Newton, like I think another mental health implication is how the experience of microaggressions, and it's especially I I think about like my own experiences and hearing about other people's experience, in particular of racial microaggressions, how that can contribute to strained interpersonal relationships, and that can impact mental health outcomes. You just get disconnected from your community because you've internalized racism and anti-Blackness. Again, as you shared earlier, Dr. Steele, Sue and colleagues, they've done a lot of work around microaggressions. And one of the things that they talked about specifically in the context of therapy too, is that microaggressions, they saw kind of create four psychological dilemmas in the interactions between members of the dominant group and communities of color. So specifically, a clash of racial realities, the invisibility of unintentional expressions of bias, minimal harm, and the catch-22 of responding to racial microaggressions. So when breaking this down, they talk about how the commitment of racial microaggressions by the dominant group goes largely unnoticed a lot of times because these behaviors are often unintentional, like you were saying earlier, Dr. Newton, and subtle. And this is oftentimes due to their position of power. So as a result, members of the dominant group may be more likely to overlook or minimize the psychological harm that they may have caused BIPOC communities, which can be particularly detrimental in the context of therapy because clients of color have talked about experiencing, racial battle fatigue because of the constant exposure to racial microaggressions. And this contributes to things like lower psychological well-being and like the weakening of that therapeutic alliance. And moreover, oftentimes we hear about BIPOC folks being placed in this catch-22 situation of trying to figure out how should I respond to racial microaggressions, especially when we think about the context. Like if you're at work, for example, like this can feel like if I say something, it can threaten like my livelihood. And oftentimes dominant group members, and in particular in the context of therapy, have talked about how they kind of depend on the behavioral cues of BIPOC folks, like maybe a change in their demeanor, their tone, their facial expression, to give them an indication that they have committed a microaggression. So sort of depending on them to alert them when it's occurred. But if you don't say nothing, then people will just continue as if it's fine when actually there was psychological harm that was caused.
Mm-hmm.
Yeah, I mean, I think that can be stressful for individuals who are being microaggression, where you're always having to process, like, do I say something? Don't I say something? What is the benefit or the loss I may experience? And so these are, just social interactions, things that go on within the social interaction we have to process that maybe the dominant or white Americans don't have to process.
Mm-hmm. And I think that what you just discussed also like further highlights the difficulty and the uncertainty that comes as it relates to responding to microaggressions, right? Because sometimes if we understand that there is not like a clear intent to cause harm, we might feel bad for addressing it, right? And so part of understanding like microaggressions and how to deal with them is understanding that it's really important that we're able to look at impact versus intent, because despite a person's intent, the impact remains. And so it's important that we're able to bring a acknowledgement of what happened and hopefully some change as well.
And I'll just add too, because I actually studied microaggressions like on my own as like for a class project, and I found that in particular, when we look at the experiences of racial microaggressions, if we're talking about Black Americans, they actually talk about experiencing things like the ascription of intelligence, second-class citizenship, the assumption of criminal status, and pathologizing cultural values and communication styles. And more specifically, in the context of therapy, Black clients have talked about experiencing, this assumption of a inferior status. So Black Americans are viewed as poor and unsophisticated, and also assume universality of the Black American experience. And we talk about all the time how people who identify as part of the Black, African, Caribbean diaspora, it is not a monolithic group, right? But Black Americans are often seen as being a monolithic group and are put in situations where they are expected to serve as the representative of their race or be the one to always educate people on racial issues or concerns as it pertains to the Black or African American experience.
Mm-hmm. And I think the types of microaggressions that you just named, like ascriptions to intelligence or pathologizing of communication styles or assumptions of criminality, like I think having knowledge of the specific types is so impactful because it helps us to understand that microaggressions aren't just about hurt feelings. They're about the messages that they convey and the behaviors that are directed based on those messages. So if we are ascribing criminality to an individual, how are we going to treat that individual, and how in turn is that going to impact that individual's life? So yes, like there is that emotional and psychological aspect of it, but there's also the social justice aspect that comes into play too when we're thinking about what is the significance of microaggressions.
Yeah, and as you say that, that still just has me remember that, microaggressions, they really work to keep the system of white supremacy in place, because by microaggression individuals, we can cause the individual to not get access to things. Because if you're struggling with, like we talked about, internalized racism or imposter syndrome or psychological impacts of microaggressions and racism, it makes it harder for the individual to overcome things, because those are just other forms of oppression.
Mm-hmm.
So then, in you all's opinion as being mental health professionals, how would you advise people to respond to microaggressions?
I would say first, go ahead.
Oh, you go ahead.
Oh, I was going to say first, I think you have to determine, what strategy you're going to use based off the situation, because sometimes it may not be safe, like physically safe for you to address the individual, or it may not be there may be a great loss that comes from addressing it. So I think you have to first determine what strategy you're going to use. Some of the strategies I often use is ask for clarification. Like, I kind of play dumb with the person, like, oh, well, I'm wondering what you mean by that. Can you tell me more? And I'll engage the individual in a conversation. Also, you can work to educate the offender about it. Like, my experience with this population has been this, or have you read this book, or have you checked out this cultural event that can help you to learn more about that population? So I think that's those are a couple of strategies I use. Ask for clarification, kind of I use the play dumb. Can you tell me more about that? Knowing that my whole ideal is to maybe set you straight, or have the conversation with you. Or you can also educate the offender about the actual truth or reality of the population or the identity that they're microaggression.
Yeah. And I was going to say something very similar. Again, Sue and his colleagues have done a lot of really great work recently around responding to microaggressions. And so they've identified like several strategies that they call microinterventions. And just as Dr. Newton was describing, they describe specific ways that targets and allies can respond to microaggressions. And so, as Dr. Newton was saying, two of my favorites are strategies with the broad goals of making the invisible visible. So expressing it through an explicit articulation, the meta communication behind the microaggression. And so, like, some of the examples they give in their articles, saying things like, relax, I'm not dangerous, or just because I'm Black doesn't mean that I'm this or that. So really, like, taking the implicit message that was communicated in the microaggression and making that explicit for the individual to be more able to understand the impact of what was said. And then other things like educating the offender. So saying things like, you might not realize this, but when you say things like with me and my hair, like things like natural hair looks good on you, what the implication is that natural hair is normally unattractive and that I'm some type of exception, right? So really helping to inform the person about like the impact of their statement, or maybe like the history or the hidden meaning behind what they were saying.
And something else I'm thinking about kind of as we're having this dialogue, it's just like, when you're born, we don't come out the womb racist, right? This is behavior that's taught, that we see modeled, that we see non-verbally and verbally demonstrated as we grow up. And so when we think about how do we handle microaggression, I think it starts at a very young age, like teaching children about the importance of respecting difference and respecting people's race, ethnicity, culture. That can be done, like if you're a clinician and you're working in a school setting, you're working with children, or you have children, like reading books, having conversations with kids about racism, and the importance of, understanding individuals. I think that that's important because, it starts very young when we start getting these messages that are microaggressions. And so we want to really tackle it. It may be starting with, children and curriculum that helps break down like anti-racism messages that we learn at a very young age or that we see modeled, behavior that we see modeled.
Mm-hmm. And I think to go along with what you're saying, too, on the other side of it, being an ally is a good way to address microaggressions in a broader sense, right? So, where we have our points of privilege, working to be advocates for those who experience marginalization can be one way to address microaggressions in our society at large. Because as we've discussed tonight already, like the experience of dealing with a microaggression can be emotionally and psychologically taxing. And then to also say to that person and address it could be a lot, right? And can compound the psychological distress that the person experiences. So if like as a heterosexual, I'm able to step in and point out someone else's heterosexism or their homophobia, like that can go a long way to address like the frequency of microaggressions in our own social circles.
Yeah, and I'll add, because I've been to various talks or and workshops on racial microaggressions, and I know that oftentimes for people who may not be the target of microaggressions, we use the term ally. And to the social justice aspect of responding to microaggressions, sometimes I feel like ally is too soft of a word or a word that people just can so freely, oh, but no, I'm not racist, I'm an ally. I like to now encourage people to be co-conspirators. So, if the idea of responding to microaggressions and using our points of privilege to disrupt and dismantle this system, and like, I need you to be a co-conspirator with me and like stirring up good trouble, and using your voice to advocate. There were, I'm glad that you brought up, Sue and colleagues work around micro interventions, just sharing some more things about to like underscore how though like that conceptual framework they created because they provided so many different types of ways that we can intervene at different levels. Because they really see micro interventions as just that, like those short-term frontline actions we can use to respond to microaggressions. And they define them as being unintentional or intentional actions or verbiage that communicates to targets of microaggressions the validation of their experiential reality, their value as a person, affirming, their racial identity or other group identities that they may hold, their support and encouragement and reassurance that they are not alone in responding to microaggressions. Because we talked about that earlier, like this catch-22 of what do I do when I'm confronted, with these statements and these messages. And you both talked about two strategies they mentioned. So making the invisible visible and educating the perpetrator. They also talk about two other strategies, disarming the microaggression, which can involve more confrontation. So rather than calling people out, calling people into the conversation, and prompting them to engage in critical self-reflection about that impact versus what they intended, and also seeking external reinforcement or support, so things like consultation or therapy. And they say that using a conceptual framework like this and some of the other strategies that you both talked about is helpful because it can help people to more readily recognize when they're experiencing racist or other oppressive behaviors from people. They can respond to people in a way that helps them to feel safe. So just like you said, Dr. Dean, like context is definitely very important. And what do I have to gain or lose by responding in a situation, helping them to figure out how to create change at the individual and systemic level, but also to like helping with people's self-efficacy to be able to like feel like they have control in responding in these situations. Because oftentimes when you think about like the psychological, the mental and emotional, sometimes spiritual impact of dealing with microaggressions day in and day out, It can definitely impair our sense of control or feeling of agency.
I think you're absolutely right. And as I think about my own work with clients who have experienced microaggressions, um, I 100% of the time recommend this reading for them because it provides such a useful framework to provide them the self-efficacy that they need to feel empowered, right? So without a like kind of heuristic framework, we're left to kind of tell clients, be brave, or think about like the catharsis that might come along with standing up for yourself. But that can be a frightening prospect, especially if we think about the real life implications that often come along with speaking out against experiences with discrimination or prejudice. And so, one of the things that I like about Sue's work is that in some ways it's like a continuum of drama, right? Like we can be a little dramatic when we address this, or we can take it all the way there, right? So I think that that is so powerful with clients because it helps them to like clearly envision how they might begin to take small steps toward addressing some of the discrimination that they're experiencing in their life. And as they grow comfort with those small steps, they're able to move forward to taking larger steps towards social justice.
Mhm. And I wanted to just hop back to Tatyana, what you said about being, I think the word you used was co-conspirator. Is that the word? I like that because it sounds powerful. And I think, for maybe white Americans or white clinicians who are watching, I think that's something maybe you have to look at. Like, how are you using your privilege and your power to help those who are often facing microaggressions? This past summer, I went to a conference for Division 45 for APA, and I presented with a particular individual, and she's like well known in like the counseling field, like a big dog in the counseling field. And she said that when she goes into meetings, sometimes she has to bring certain white faculty with her so that the voice will be heard. And I was like, well, you a big dog in the field. Like, why don't they just hear you? Like, I totally respect you. But I thought that was kind of sad to me that this woman has all these credentials, all these publications, well known. But she even said that where she's at in her career, like certain folks, certain tables she'll sit at, they won't hear her. So she'll have to bring in a colleague who is white to say the same thing and it'll be heard. And so I think, as you're watching this, if you are white American, you're a white clinician, think about, the spaces in which you have power where you can shut down microaggressions and you can bring about, cultural humility and break down racism within your environment because your voice may be heard over someone who is experiencing microaggression. So
And I think that I'll add too to what you both shared earlier is that, in the context of microaggressions, it's not just limited to people's racial realities, but any group identity that they may hold where they experience marginalization and oppression. So I really loved how you talked about, Dr. Steele, like recognizing the privilege that you have as being, a heterosexual Black woman, and even like within our community, how certain voices within our community are silent. So being a co-conspirator within our communities as well.
Mm-hmm.
So then my last question for you all is, what should we do if we commit a microaggression?
So I'm gonna be transparent. I had shared this with Dr. Steele when it happened. I think it may have been last year or earlier this year. I was teaching. I'm teach at a university. I was teaching, and we were talking about like how to create support for our clients. And I have an intervention called Finding Your Tribe. That's the name of the intervention, Finding Your Tribe. So I went through and I told the students how to find your tribe, blah, blah, blah. And one of the students, she unmuted, it was an online course, and she was like, "Are we still doing this?" And I was like, "Lady, what's going on? What are we doing? Are we still doing this? The word tribe, that's offensive. I can't believe you used that word." And like she just went off. She didn't call me in the conversation. She actually shut me down. I was the professor of the course, but she shut me down. I was like, oh, okay, well, you upset. And she went on to talk about the word tribe. She's Native American, Indigenous. And she began to just talk about how that wasn't an appropriate word to use. Well, when I developed the intervention, finding your tribe, it was more for African Americans. And so in African American culture, the word tribe, there are tribes in Africa. We talk about tribes, talk about village, having a village of people is not an offensive word, but in her culture, tribe had a negative meaning. And so I share that example when I personally microaggression people. I share that example because what I had to do is then educate myself. Like, we can't expect individuals to educate us. So I did talk to Dr. Steele about it because I was kind of shut down after it. So I called her, I texted her, but then afterwards I started research. I said, why is the word tribe offensive? And then I discovered that the word tribe in like Native American and in certain indigenous cultures was equated with savage. So people who came over and colonized, they began to call them tribes, which then became equated with being savage, which has a negative connotation. And then also the use of the word tribe, as I did my own education and research around it, there's like a historical context around it where people were being stripped of like their identities and they were just put into these tribes per se by those who were colonizing the United States. And so again, it was a way of disempowering and oppressing people, but I didn't know that. So I didn't know. So I had to go and do the research and educate myself. So I think one of the things is when you experience a microaggression, even if the person shuts you down about it, like what happened with me, like don't just stay shut down, like educate yourself, process what just happened so that you don't make that same blunder in the future. So I would say for me, it's really education can help.
Yeah, and I think, for me, the thing that stands out to answer this question and in Dr. Newton's story actually is the importance of not becoming defensive, but instead making it your goal to gain understanding. And so as Dr. Newton's story would suggest, like, sometimes it's not best, like, to put the onus on educating us on the person who's been targeted, right? So like, sometimes it might be appropriate to say, well, I'm sorry, could you explain to me, your feelings behind use of this word? Sometimes that might be appropriate, but other times that might be like a contributor to the distress that the individual is experiencing. And so it's important for us that once we become aware of these things to seek our own education, but then in the relationship itself, like, to do the things that we would normally do as therapists to repair a rupture, right? So one, acknowledge that something has happened. Say, I'm sorry that I offended you, or I apologize for communicating that message, validating the individual's feelings about it, inviting them to a conversation if they would like to have one. And then, as Dr. Nunes suggested, like, figuring out where the mishap happened so that you can avoid it in the future, but then also working directly and explicitly with the individual to begin to repair the relationship.
Yeah, and I like what you both shared, and I appreciate your personal example, Dr. Noon, because I think like that process that you just talked about is like you spent time engaging in critical self-reflection after that happened to build critical consciousness so that you can engage in critical action. Like how can I engage in anti-racist work? Well, first I need to educate myself so that I don't perpetuate this. And I think too that this helps us to not get stuck in a place of guilt or shame, because when we get stuck in that place, it closes down the re-education that needs to take place, or what you talked about, Dr. Steele, going back and repairing the rupture to that bond, and the strengthening that needs to take place. And also too, I think what you talked about too is like, when I was sharing this intervention, I'm coming at it from my racial reality as a Black woman who identifies as a part of the diaspora. I wasn't thinking about, if we're talking about this in a multicultural classroom or setting, how this may land with folks from different cultures. So in that way, like what we've been talking about, oftentimes with microaggressions, it is subtle and not intentional. So I think for everyone, for myself and everyone listening to this conversation, giving ourselves grace that we all live with biases. Like social psychologists even talk about it. Like if we couldn't categorize people and have ready-made heuristics, like our brain would explode. It does that to make sense of the world and how we filter experiences. But knowing that we are all striving to become more self-aware and to become more accountable so that we don't continue to perpetuate these microaggressions. And I really liked that article by Sue and colleagues. I was, reviewing that in preparation for this podcast, and they talk about like, it's helpful to engage in soul searching about who we are as racial and cultural beings, acknowledging and overcoming our own biases, working toward engaging in anti-racist work, and recognizing how our lives will be changed for the better in the absence of oppression. So in the absence of us being the one, perpetuating or upholding these harmful systems.
Mm-hmm. And just taking the feedback. I'm thinking about recently, Dr. Newton and I did a presentation on implicit bias and microaggressions. And one of the participants' feedback was like, you have microaggressions in your presentation about microaggressions. And I was like, what? And so what she mentioned was that we use the word blind spots, right? Like, so we were trying to convey this idea that microaggressions often occur unintentionally because we have assumptions of which we might not be aware, right? So we took that feedback, even though we certainly didn't intend to convey like a dismissive message. We took that feedback and we just changed the word blind spots to assumptions, and we won't say it again. And so, I think to your point, part of the need there for us as individuals when we commit a microaggression is to like maintain a stance of cultural humility, and not falling back into an urge to be guilty or defensive, right? Because neither is helpful, but instead continue to seek to be other oriented and look at ways that we can begin to repair and reinvigorate the relationships that we have with people.
Mm-hmm. So I think sometimes when we talk about issues like microaggressions and race, people become so fixated on not getting it wrong, saying the wrong thing, messing up. And to me, that's where the growth happens. Like we don't want to purposely microaggression anyone. But when that does happen, that is an opportunity for us to learn. So like with the Find Your Tribe activity, I know now you give a caveat, this may not apply to certain cultures. You may want to use other words like find your group or find the people who have your back. And so I think it's though the ideal that you're continuously growing, we're continuously growing. And you have to extend grace. I think I heard Tatyana say that, extend grace to yourself.
Mm-hmm. And I love that you just said, Dr. Newton, that while it is never our intent to get it wrong or offend, I feel like sometimes, especially for, white folks or people who identify, within dominant groups, when you spend so much time trying to get it right or get it perfect or not get it wrong, you end up committing the microaggression anyways. Because you're not being genuine, you're not being authentic. It can come off as performative. And that's oftentimes, for graduate students who may be in counseling psychology or counseling mental health related fields, that's something that comes up a lot in multicultural classrooms and settings when we're engaging in these cross-racial, cross-cultural dialogues. People are kind of on the sidelines. Well, I'm just observing. I'm just listening. I don't want to say the wrong thing. I don't want to offend anyone. But especially in the context of training programs, it's the time for that to happen so that we can get re-educated, reoriented, have time to engage in that critical self-reflection. Because if you don't, then you'll go out and perpetuate it in the field, and that's what we don't want. So yeah, that triggered me a little bit when you said that. Like, I definitely resonate with that piece. Like, let's just get it out in the open, and get it on the table. This is a space where we're giving each other grace. We're calling each other in as opposed to calling each other out so that we can have that re-education, that connection, that transformation, that community, because it doesn't help when you're trying to, in a sense, like hide your ignorance, for lack of a better phrase, by not talking or observing or standing on the sidelines. And how, especially in the context of racial microaggressions, being a bystander, can be a form of violence, because it can almost seem like you're complicit in it. You're not doing anything to actively take a stand against it.
Mhm. That's what I was going to say in response to what you've been saying, that fear of saying the wrong thing that leads us to be silent can actually end up becoming the biggest microaggression that we commit in the counseling relationship, right? Because when we don't say anything and when we don't acknowledge the racial realities or other cultural realities that our clients are facing, they can perceive that silence in all kinds of ways. They could perceive it as you not understanding or you dismissing or you being uncomfortable, which signifies that something is wrong with this topic. And so even our silence can be a microaggression in that way. And so it's so important for us to be able to step out of that, right? Even if it does require some courage, or you can think of it as curiosity, whatever helps you. But it is so important for us to explicitly and verbally acknowledge the experiences that our clients are bringing into session and being our authentic selves as we're doing that.
Mhm.
Mhm. Yeah, and I think that gets at what people have been talking about now more recently, brave spaces as opposed to safe spaces.
Mm-hmm.
That's good.
Yeah, but to go along with that and with what you said earlier, it's also so important that we orient individuals to this process, because sometimes like it could be off-putting, right? Because people aren't used to that in their everyday life. So when you acknowledge or bring these topics up, they might be thrown off or wonder why you're asking me that, or take it to mean that you are making some assumption about them. And so it's really important that we have those initial conversations with our clients and we explain why we might be talking about these things and the significance of it in their treatment.
Mhm. Yeah, and I think we as clinicians have to, as we're doing our own work, as we're doing it, we have to normalize discomfort that, if you're really doing work around your own bias, around your own stereotypes of people, you're going to have to be uncomfortable, and that's okay. I was uncomfortable when my student called me out. It was a little embarrassing, but there was a growth moment for me, and so I'm okay with that. Um, yes, I think normalizing the discomfort, I think, as we do the work is important, and it's just natural part of what we're doing.
And the research has shown that even when there has been a rupture that has occurred in the therapeutic relationship as a result of the therapist committing a microaggression, when you acknowledge it, you apologize, you validate, um, all the things we've been talking about, you take those cultural opportunities, and you engage in cultural humility, the relationship is better for it because it communicates to the client all the things that we've been talking about. You see me, you hear me, you genuinely care. And it just strengthens the bond overall, and it leads to you all being able to do some really good work because it builds trust.
Mhm. Mhm.
So I'm not sure in the midst of us talking, if there's been any comments, Dr. Steele, or questions in the chat.
No, we don't have any comments or questions tonight.
Okay. Well, if there is nothing else, then Doctors Newton, Steele, and I would like to thank everyone for joining us. And for those of you that will tune in later, and if you are interested in continuing to learn more about the topics we discussed tonight, please check out their book, Black Lives Are Beautiful, 50 Tools to Heal from Trauma and Promote Positive Racial Identity, which you can find on Amazon.
Thank
Thanks,
you.
everyone. Good night.
Good night.